The COVID-19 pandemic can cause serious mental health problems. One such is post-traumatic stress disorder. Shamela Pullen has more in this evening's edition of the Health Report.
People are usually diagnosed with post-traumatic stress disorder or PTSD after they have experienced a shocking, scary, or dangerous event. Given the negative impact of COVID-19 on some people's finances, social, and personal lives, consultant psychiatrist Dr. Jeffrey Walcott says this could result in long-term mental health issues. Dr. Walcott says already studies have been pointing to an increase in anxiety and depression, both contributing factors for post-traumatic stress disorder.
One is the issue of the re-experiencing. So persons may have flashbacks or nightmares, especially those that have been hospitalized and have had to go through the horrendous experience of being ventilated or having shortness of breath. So persons may actually get nightmares, intrusive thoughts throughout the day, and that can continue for anywhere from a month to years after the event.
The psychiatrist further explains that substance abuse is also closely affiliated with PTSD.
Alcohol in particular is very troubling because alcohol causes not just medical or health problems, but causes a lot of social problems such as domestic violence, risk of suicide. Alcohol is associated with all of these problems, and what we've seen, especially in the pandemic, is certainly there's an alarming issue with regards to domestic violence within the homes, not just locally but globally, and these are something that we have to look out for.
The condition affects males and females primarily between the ages 25 to 40 years. It can oftentimes be treated with medication and therapy. But Dr. Walcott says prevention is key. He offered this advice.
In fact, when there are some studies that have come out of China that look at some of the preventative factors for the risk of psychological impact, and found that persons who adhere to the hygiene and the mask wearing and who follow the protocols are less likely to develop the psychological ramifications in the long run, because they maintain a certain level of control. So the persons who are not adhering, who have taken a stance that it is hopeless, that the situation is dire and that nothing can be done, that are chaotic, are the ones that are most at risk.
With your health report, I'm Shamela Pullen wishing you good health.